Hospital Anxiety and Depression Scale. Introduction. This assessment was developed by psychiatrists Zygmunt and Snaith in 1982. It is used to measure anxiety and depression in a general medical population of patients. The questionnaire comprises 7 questions for anxiety and 7 questions for depression. Purpose of assessment: to detect states of depression and anxiety in the setting of an hospital medical outpatient clinic and to measures of severity of the emotional disorder. Only valid for screening purposes, not diagnosis. Type of assessment: self-reported. Component being assessed: anxiety and depression symptoms. Indication for this assessment: primary care patients and general population. This assessment cannot be used for patients who have no insight or self-awareness. Administration procedure: patients are given assessment form. Patients are required to complete it in order to best indicate how they have felt in the past week. Patients are asked not to take too long over their replies, immediate reply is best. It is reasonable to administer the scale again but at not less than weekly intervals. Administration time only takes 2 to 5 minutes to complete. Scoring procedure: the questionnaire comprises 7 items for anxiety and 7 items for depression. Each item on the questionnaire is scored from 0 to 3. This means that a person can score between 0 and 21 for either anxiety or depression. After administered, total up score for anxiety and depression items separately. Interpretation of assessment: psychometric properties: has good internal consistency in both subscales. Most factor analyses demonstrated a 2-factor solution in good accordance with the HADS subscales for anxiety and depression. The sensitivity and specificity for both HADS-A and HADS-D of approximately 0.80 were very similar to the sensitivity and specificity achieved by the General Health Questionnaire. Correlations between HADS and other commonly used questionnaires were in the range 0.49 to 0.83. Advantages of assessment: easy to score and simple to interpret. HADS provides clear cut-off scores to indicate the severity of the disorder to help inform appropriate interventions. It is ideal for use as a screening measure. Disadvantages of assessment: does not include all of the diagnostic criteria of depression and only valid for screening purposes. Demonstration of assessment:
Assalamualaikum.
Assalamualaikum.
How are you?
I'm fine, thank you.
I'm Ayub. Today I will be your therapy. Today I'm conducting hospital anxiety and depression scale. The purpose of assessment to detect state of depression and anxiety and its severity. This assessment contains 2 parts, which is depression and anxiety. You have to answer all the questions. If you don't understand, you can ask me. Are you okay?
Yes, never mind. Okay, yeah.
Okay, thank you.
Yeah.
For the scoring, the client scores 7 for both areas, which is normal range for both areas.